Good morning, New Zealand, and good morning, Pro Skin Poppers. I'm Dr. Andrew Christie, live from my lounge here in Paris. I'm a little bit excited. The sun is a little bit delayed with coming up this morning. So in around about 15 minutes, the room is going to illuminate and you're going to see the sunrise in the windows behind me. We had some slight technical issues this morning. So unfortunately, Michelle was unable to introduce me, but I know that I know about around about 90% of you. Michelle is watching online and she's still able to support and moderate our questions for today's session. For those of you who joined us last week, it is a pleasure to have you back. But for those of you who are new for today's session, welcome, bienvenue. So for the format of these sessions, Live to Your Lounge is about being casual, it's about informal, and it's a conversation piece about all things Dermapen world, all things Dermapen 4, all things DP Dermaceuticals, covering tips, covering tricks, indications, protocols, and combinations therapies. Today's topic, I really want to explore the do's and don'ts of a Dermapen 4 treatment to ensure a safe, to ensure an effective, and to ensure the most enhanced procedure that you can possibly perform. As with our last session, we have Hugo and we have Pete as our moderators behind the scenes. Hugo is based with me here in Paris and Pete is in the Dermapen World Sydney office. Thank you very much for your invaluable support. If you have any questions throughout today's session, all you simply need to do is go to the center of your screen. You'll have a Q&A tab. And then if you write in your question between Michelle, Pete, and Hugo, they will then moderate the topics and moderate the questions being asked, and they will end up in my inbox on the side of my screen. So try and keep the questions relatively close to what today's topic is, and then that means that we've got relevance, but we also have value for those questions. I envisage today's session is going to take us just a little bit over half an hour as well. Also, don't forget to include your experience, but also don't forget to add this whole webinar session onto your social media. Now, at the moment, please make sure that you are obviously following on Instagram, Pro Beauty NZ, that you are also following Dermapen World. Please feel free to add me for Instagram. I'm Dr. Andrew R. Christie, all in one word. Instagram's easier for me. My Facebook is now full. However, for Facebook, as no doubt you are probably already on the Pro Beauty Pop, please also include Dermapen World. And then for me, I'm Andrew R. Christie. So let's have a talk and let's begin with the do's and don'ts to create the ultimate Dermapen procedure. The first do is to treat your patients visually. The don't is not to treat your patients mathematically. Since its inception in the early 1990s, there's always been this misconception that microneedling needs to be an exceptionally bloody experience. So the more blood, the more trauma, then arguably the better the result. Let's quash this one. In a study established by Des Fernandez himself, a plastic surgeon from South Africa, Cape Town, and his German counterpart, Dr. Matthias Aust, in 2006, they established, despite all of their previous work in the 1990s with 3mm rollers and stamps, that you can achieve the same level of collagen activation, collagen synthesis, collagen regeneration, and collagen production from 3mm of depth as what you can with just 1mm of depth within the skin. So more blood does not equal a better treatment. Likewise, also, I'm noticing that there is a huge trend across social media that microneedling practitioners are now taking obscene bloody photos of their patients and then posting that online in order to create a conversation, in order to create controversy. Whilst this might get some people some attention, whilst it might get them some more followers, This doesn't represent the treatment fairly. You can imagine that if your average consumer or if your average patient sees these images of people covered in such a large amount of blood, then the average patient will assume that this is an exceptionally painful procedure, exceptional trauma, and exceptional downtime. None of this is true for a dermapen 4 procedure in 2020. So what we want to promote are procedures where the patient sees the value and we promote the comfort, promote the efficacy, but just 36 to 48 hours of a mild to a moderate sunburn in appearance and sensation following the procedure. No bruising, no scabbing, no grazing, no track marks. So we see that posting these images is not advantageous. Last week, I threw out a mission for you, and I went through perhaps a couple of my least favorite words that I need to use on a daily basis, which I either can't say or I can't spell. So such words included Staphylococcus, erythema telangiectatic rosacea. With this, I want to set a challenge for today, and no doubt to try and fill in some time during isolation. You have been looking at a lot of social media. I want to find out what has been the worst advice that you have seen from a vlogger or a blogger on social media, but that vlogger or blogger has absolutely no formal training or experience in aesthetics or in our industry. So what I found from just a general guy who wanted to create nice skin, no education within this field, he was recommending online to use a 1.5 millimeter roller every single night on his skin until his face was pouring with blood so that his moisturizer would work more effectively. So we see that whilst we do encourage interaction and education with our patients, we don't encourage bad information. We do encourage education. We don't encourage people with no experience to start promoting such bad practice. So when we understand that treating with your dermapen, we do treat visually, this now means that we don't treat mathematically. So how do I know where my needles are? If you see no blood but no color change, your needles are working in stratum corneum. Cute, but not deep enough to make any long-lasting change or correction. If you see no blood but the skin is pink, then your needles are working in granulosum. If you see no blood but the skin is red, then your needles are working in basal spinosum, epidermis. Once you begin to start to see pinpoint blood, then this is your indication that your needles are now reaching and touching into the vascular activity in superficial papillary dermis. Once you then begin to see mild to moderate large amounts of blood coming out, this is your sign that your needles are working in the hypodermis. And for most indications, this is too deep. This is too aggressive. Another area that I want to focus on to encourage is do understand that your dermapen is a standalone procedure. Your dermapen has the versatility of being able to change your needle depth at any point at any time. So the minimum is 0.2, perfect for around the periorbital area, the perioral area, even moving into intimate rejuvenation. The maximum is up to 3 millimeters, which is the scar treatment setting. The philosophy, as we covered last week, is to create a controlled autologous regenerative puncture channel into the skin, which then activates growth factor release, regulated collagen, but also angiogenesis. So I want to encourage you to understand that this is a versatile standalone procedure that can work in combination with other products and procedures, including your DP dermaceuticals for infusion, including other products such as PRP or the brand new MG collection for infusion from DP dermaceuticals. It's not a substitute for fractional laser. This is not the poor cousin of laser. This is not the poor brother or sister of injectables. This is a standalone, independent dermapen procedure which will promote its own balance of corrective cascades and its own process to enhance skin function, skin quality, and skin integrity. So although the device may be cheaper by comparison to something such as laser, it doesn't make it any inferior. Remember, by removing the heat with the Dermapen 4 device, no risk of post-inflammatory hyperpigmentation. But remember also, because we have a clean angle of entry point and exit for the needles, no activation of profibrotic growth factors, which means no risk of abnormal scar tissue formation. This means, as opposed to so many other modalities, that you do want to encourage your Dermapen for treatment of 100% of Fitzpatrick skin types and 100% of ethnicities coming into your business. Versatility with pinpoint precision for every patient, every time. I also want to consider that your skin here is a canvas. You can stretch it, you can pull it, you can tighten it like the canvas from a work of art. You can put a big brand new gold frame around that. But the reality is, if the quality of the canvas is in not a good condition in the first place, none of this is going to make the painting any more aesthetically beautiful. So what I'm talking about is that maintenance and support of your skin becomes paramount to ensure more effective, longer lasting, and more durable procedures as part of Dermapen, but also as part of your combination therapies. The success of a Dermapen procedure fits into the largest growth area of aesthetic medicine and aesthetic dermatology right across the world at the moment. We call this regenerative medicine. These are practices, these are procedures, these are combination therapies which work to activate your body's own process of healing, repair, rejuvenation, and regeneration. Arguably, microneedling is the pioneer of regenerative medicine. However, we look at other procedures, including nanofat. We also take into consideration other procedures such as PRP. The success and what I do encourage with your Dermapen is the release of regulatory growth factors, this cascade which enables management, balancing, regeneration, rejuvenation, and correction of functionality, integrity of the skin is what creates a healthy canvas, is what creates a well-functioning canvas, is what supports the biological cascades of the skin itself. As such, if we have a look at very popular procedures on the market, let's consider botulinum toxin. You can put as much botulinum toxin as you want into the skin, and similarly to my hand, it can prevent muscular contraction, but if the quality of the skin above that is not of good quality, good integrity, then all you have is bad skin which doesn't move. If we take into account filler, where it's injected above the bone or subcutaneously, again, if it doesn't directly affect the quality, the integrity, the functionality of the skin above, then all you're going to have is volumized skin, but skin still of a bad quality. This is why you want your Dermapen procedures as a standalone treatment, but also as part of combination therapies. It's these needles and the 1,920 puncture channels per second facilitating the release of those regulatory growth factors, now facilitating better quality, function, and better integrity of the skin as a physical organ and the physical tissues itself. So what this now promotes for us is better quality skin. As such, this now means, as part of your combination therapies with Dermapen plus DB Dermaceuticals, we now turn okay skin into good skin, into great skin, and then the ultimate of phenomenal skin. So supporting your treatments with microneedling, with your Dermapen 4 for all of your procedures now works on the skin quality itself. However, there are some conditions. You want your patients to do support their procedures with at-home topical skincare. I look at the dentistry market. In order to create perfect oral hygiene, what you need are a few things. First, you need to brush your teeth, toothpaste, toothbrush, dental floss, twice a day, every day. However, you also need to catch up with the dentist at least once a year. And the dentist, as the expert, directs, guides, and manages the overall treatment program. So the role of topical home care products becomes instrumental because these are like toothbrush, toothpaste, and dental floss to be used by your client twice a day, every day. This is what supports the canvas, supports integrity, but this is what now promotes a better quality canvas, so we can now reinforce even further within the skin as part of your Dermapen procedures. So the role of topical skincare becomes paramount. My first non-negotiable, particularly for the New Zealand market, is to make sure that you are wearing but reapplying 3 to 4 times a day sunscreen. The DP Dermaceuticals Cover Recover is available now in 11 shades. There are some updates. The clear version, which I'm showing here, can be used particularly for areas where you don't want coverage on the neck, on the chest, but on the backs of the hands. It dries very lightly, so there's no greasy afterfeel, particularly for application on the backs of the hands. But in the tinted versions or the sheer, it means that it can be effortlessly reapplied throughout the day without compromising any makeup, but still ensuring coverage. Also, as part of effective home care treatments, I look at, particularly for anything where we're looking at skin rejuvenation and regeneration, products such as the DP Dermaceuticals Bright Light, the use during the day as a tyrosinase inhibitor to sedate and to manage and influence the melanogenesis process, but at night time, the DP Dermaceuticals Retinol Active. This contains 0.05% of retinaldehyde. And whilst that sounds exceptionally small, that is in fact 400 times more potent and stronger than cosmetic grade retinol at 1%. So we see the balance, but we see the value of the retinaldehyde here is that greater potency, but without irritation and without photosensitivity, and now enables, in conjunction with the rest of your DP Dermaceuticals products and daily application of your Cover and Recover, to now support and maintain skin quality and to now support and maintain the skin as a canvas working from the top down. So with this, I view the role of your Dermapen procedures working within the skin from bottom up, but then application of your daily skincare, we want to encourage so that our clients can create daily a healthier looking, better functioning skin. In order to enhance your Dermapen procedures, we see the value that with nearly 2,000 puncture channels per second into the skin with your Dermapen 4 device, and this is when it is operating at full speed, this now can be used to facilitate and to infuse treatment and ingredient actives into the skin. At full speed, it's 120 revolutions per second, 1,920 puncture channels per second. To now facilitate perfect distribution, but to now facilitate safe infusion, this is where your DP Dermaceuticals comes in. So do combine your Dermapen 4 with your DP Dermaceuticals as your treatment program. Do not substitute your DP Dermaceuticals with other products. The DP dermaceuticals are all specifically and precisely engineered and formulated for infusion into the skin. So your corrective products, including DP dermaceuticals Hyla Active, including DP dermaceuticals Bright Light, the DP dermaceuticals Retinol Active, Antioxidant Cocktail, and Clearer Lotion, have all been designed and molecularly manipulated for safety and infusion to go into the skin. Some features include HylaFuse triple molecular weighted hyaluronic acid, which now sees the hyaluronic acid molecule manipulated down to just 10 kilodaltons in molecular weight. This serves as a safe delivery mechanism, ensuring that there is no risk of granulomas, no risk of burning, no risk of reaction, but it also serves as a delivery system to encapsulate other active ingredients, including the tyrosinase inhibitors, kojic acid dipalmitate in the Bright Light, including niacinamide and rooibos in the antioxidant cocktail, but also the retinaldehyde in the Retinol Active, the oligopeptide 10s found in the Clearer Lotion. This means that the formulation is molecularly weighted so it cannot get stuck within the skin. It means that all the formulations are at the right pH, so there is no risk of burning within the skin, which then in turn means no irritation, no reactivity, no sensitivity. An update, which we'll see later on in the year, includes the brand new MG collection from DP Dermaceuticals. And these deliver even more potent delivery mechanisms combined in with a calphosome delivery system. And this is a calcium phosphate, but features also include telomere technology, the HylaFuse technology, and potent anti-inflammatories, all presented in a 5 ml sterile vial that can be mixed and matched, applied topically onto the skin, but these also link in with a Luer lock syringe, enabling for traditional mesotherapy. I now move into some functionality of the pen itself, and do understand that the power of your DermaPen is what separates it from just any old micro needling device. There's a reason why your DermaPen is this size and this shape. It can sustain and facilitate far greater power and efficacy than its competition. With this power means that when you operate at full speed, which is 120 revolutions per second, speed 1 is 66, speed 2 are 90 revolutions per second, speed 3 105, and speed 4 the Formula One race car of microneedling, an unprecedented 120 revolutions per second, now delivers an unparalleled 1,920 puncture channels per second. This means that you can operate fast. As such, a full face can be performed in as little as just 4 to 5 minutes. So working quick at full speed, following your DermaPen directions of vertical stripes, across, diagonal 1, diagonal 2. So I want you to imagine the Union Jack sitting in the top left corner of the New Zealand flag, and it's these stripes that you want to replicate to enable fast and effective treatment. DermaPen is about autologous regenerative correction within the skin. So it takes us above and beyond where your hands can treat with a facial, above and beyond where a very superficial peel works on the skin surface, and above and beyond where a superficial microdermabrasion works on the surface. So as such, this is not a spa treatment. So slow movement does not mean better efficacy. Working quick, working effortlessly, and working at full speed for your traditional procedures is what creates comfort, profitability, and what delivers the ultimate of results by maximizing your puncture channels. However, do understand that although there are 4 speeds with this device, do remember that you have a scar treatment setting, which automatically alters the speed when you are at the 3mm depth. Notice that you hear the change in sound. it reduces it down to 60 revolutions per second. So I do encourage that we understand the difference between fast speed and gliding technique by comparison to a slower speed and implementing an imprint technique. So to describe this, for your standard rejuvenation procedures, for your standard pigment reduction, acne revision, and for superficial scars, it's advantageous to have your device at full speed and using your striping technique. Vertical, 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 horizontal, 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 diagonal, 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 working quickly. However, just by reducing your speed down, choose your depth accordingly. So if scar tissue is red, blue, or purple, this means that the scar tissue is concentrated within the dermis. You want to look for pinpoint blood as your visual endpoint. Once scar tissue is either bound or contracted or white, including stretch marks, this is the only time you might ever need to draw a little bit more blood down to the hypodermis. So for the average patient, you're looking for pinpoint blood. But by reducing your speed down, first, do remember that not all treatments for scars are going to be at 3 millimeters. So irrelevant of what your depth is, by reducing the speed, you can imprint. Imprint is not like stamping. That's practitioner dependent. But if you imagine my finger here is like a hypertrophic scar, if you hold at a 90-degree angle and then needles out, so 3 seconds, 1, 2, 3, out, 1, 2, 3, you can re-angle. If you need to support the tissue as you re-angle, particularly for deeper rhytids, perfect. And so by reducing your speed down, it means that we are not ablating the tissue, particularly when you want to concentrate the punctured channels and concentrate the rejuvenation around the skin. For the same reason that your smartphone updates regularly so that it is working in peak optimum condition, for the same reason that you need to plug your laptop in and you need to let it sync and download updates, don't see syncing as being a hassle with your Dermapen 4. Do see syncing as increasing the value and the technology of your device. So syncing your device when it's required with your smartphone now downloads the most up-to-date firmware and software material, ensuring that your Dermapen 4 is just as valuable today as what it's going to be in 7 years' time after you purchased it. So this ensures your warranty. This now promotes effortless, flawless running of the device, but it also means that this device is always working at its optimum peak and optimum performance as well. Back onto skin, do remember that your Dermapen is activating a controlled wound healing response. And as such, do remember that you want to work in with the body's own natural cycles. This means don't overtreat. Don't treat your patients every day. Don't treat your patients every week. Don't draw blood every 2 weeks, every 3 weeks, every 4 weeks. And the reason why is we work in with the wound healing response. Inflammation, proliferation, maturation. The inflammatory response is biologically resolved in a 14-day or 2-week time period. This is the reason why you can, and I do encourage, that you perform your more superficial treatments potentially as often as every 2 to 4 weeks, but no blood. However, because the proliferative response sees the transition of immature into mature collagen for the average adult at around about the 6 to 8 week mark, this is the reason why when treating adult skin that you will want to treat every 6 to every 8 weeks, no sooner, and preferably no later, to now promote regulation of the proliferative response. This now develops into the maturative response, which sees the continued remodeling, regeneration of the tissue, the extracellular matrix, and the collagen, anywhere up to 2 years after one procedure. In order to maintain the most efficient treatment, remember that you want to stripe for your average rejuvenating procedures. Again, think of the Union Jack in the top left corner of the New Zealand flag. Vertical, horizontal, diagonal 1, diagonal 2. Don't use circles. When you use circles, particularly when the device is at full speed, or if you are circling too fast and the device is at a lower speed, you're going to rip, you're going to tear through the skin. That goes against the philosophy of Dermapen and automated microneedling, which is to promote a controlled micro-trauma response, but to deliver resolution for this as well. For those of you now taking your skin from okay skin to good skin to great skin, phenomenal skin can be achieved with Dermapen, DP Dermaceuticals, and a product such as the Uber Pro. Don't apply your Uber Pro first onto the skin. There's always this consensus that if I exfoliate the skin first, then my Dermapen needles are going to penetrate deeper into the skin. No one has 3 millimeters worth of dead skin sitting on top. No one has 4 millimeters of dead skin there. So the concept of exfoliating prior to treatment is nice, but using your Uber Pro following your Dermapen procedure as an anabolic chemical peel that works as a mesotherapy, it means that the Uber Pro is able to travel down the 1,920 puncture channels per second into the skin to now promote an anabolic rebuilding regenerative effect. So the design of your Uber Pro is specific for application following Dermapen, not before. The design also of the Uber Pro means that it can be used on all Fitzpatrick skin types and ethnicities, even on skins with a risk of post-inflammatory hyperpigmentation. The peel I describe as anabolic, which means it activates a process of rebuilding and regeneration. It's not your traditional exfoliating or catabolic peel, which is activating a process of removal and a process of desquamation. So what I now encourage is do create a synergistic effect of Dermapen plus your DP Dermaceuticals for infusion plus your Uber Pro to now create the ultimate. So we now take okay skin and deliver with topical home care good skin being used twice a day. We then use Dermapen, which gives us great skin, but now adding in DP Dermaceuticals for infusion during your treatment, Uber Pro for application post-treatment, plus Dermapen takes you from great skin to phenomenal skin. And this now works to rejuvenate, regenerate, correct, rebalance within the skin, not just on the surface, to address all things texture, tone, quality, integrity, and functionality. And of course, I do encourage that you never stop learning. Don't feel that one training session is going to get you confident for the rest of your life. Remember that education is a journey and not a destination. That concludes my formal part of the session, but now I'm going to cover some of the questions for this. So I've been asked, in order to treat pigmentation at around about 0.8 to about 1 millimeter, are we promoting collagen also? Let's assess. The cell which produces pigment is a melanocyte that lives in basal epidermis. The cell which produces collagen is a fibroblast, which exists at an 87% concentration here in the dermis. So we understand that if you want to promote a rebalancing effect for pigment, you need to be treating more superficially. How do I get this even more exact? For traditional hyperpigmentation, uneven skin tone, we call this facultative hyperpigmentation. Post-inflammatory hyperpigmentation for lentigines, for ephylidase, age spots and freckles. You want to focus on the melanocyte, but where it transfers the pigment capsule into the keratinocyte, and that occurs in spinosum epidermis. This means visually you're looking for no blood, but pink skin. If you wanted collagen, that's too superficial. If you want to treat melasma, you need to go a little bit deeper. Melasma is characterized by the collection of melanin by a macrophage in the superficial papillary dermis. This pigment-containing macrophage becomes known as a melanophage. So only in the case of melasma or a condition such as ashidermatosis is the only time you want to see just the very occasional pinpoint blood. However, for treatment of collagen induction therapy, anti-aging, scars, stretch marks, you need to be seeing a consistent pinpoint blood all over the skin. If you want to treat pigment and collagen induction therapy, why not alternate your treatments? So if you create a treatment plan where your first treatment draws pinpoint blood, it means that your needles go through the melanocyte down to the fibroblast, but then 4 weeks later, you can treat more superficially. So again, you're focusing on that controlled inflammatory response as well. The next question is the wound collagen we promote a weaker form of collagen? Not with microneedling and not with dermapen. When we look at other modalities such as red light, LED, when we have a look at cold laser or low intensity light therapy, the reason why your patient needs to undergo these procedures long term and for a long period of time is they trick the skin into producing type 3 collagen. Type 3 collagen is the immature collagen. Type 3 collagen, in this case, doesn't transition into the stronger type 1 collagen. No wound is made, so this creates a different response for wound healing. With dermapen, however, at a top speed of 120 revolutions per second, we are creating and activating a full wound healing response. So the design of this is because there's no heat, there's no ablation, rather than releasing what's called pro-fibrotic growth factors, which are your precursors guaranteeing scar tissue, what we see is activation of what is called scarless wound healing. This sees, if you imagine the puncture channels, the immature type 3 collagen traveling up those puncture channels, but as part of the proliferative wound healing response, over the time period of 6 to 8 weeks for the average adult, the immature type 3 collagen then undergoes a transition where it turns into the strong, structural, and durable type 1 collagen. So dermapen activates a scarless wound healing response, but because of the physical trauma or micro trauma it instigates, this means that you have collagen in the right place, but we see the transition and the development into the right form as part of a controlled proliferative wound healing response. The next question, if you do a deeper treatment, is that also going to affect pigment? Yes, it does. So as your needles go through the melanocyte down to the fibroblast, they will hit through. However, we understand that you don't want to be drawing blood more frequently than every 6 to every 8 weeks. If you do, you're going to activate the body's full trauma response, which means pro-fibrotic growth factors, which means abnormal collagen deposition, but there's also a risk of post-inflammatory hyperpigmentation. So that's why I recommend that you alternate your treatment depths. So you can perform your pigment treatments more superficially, no blood, as often as every 2 to every 4 weeks. For your blood procedures, you treat with pinpoint blood and performed as often as every 6 to every 8 weeks. So you could alternate between deep, 4 weeks later, superficial, 4 weeks later, deep, 4 weeks later, superficial, in order to customize your treatment program. Likewise, also, I've been asked if you're treating a patient and they've had treatments before and you're struggling to draw blood, what's happened? This is a great sign. It means that your dermapen has now activated regulated collagen deposition and the skin is now thickening. This is the reason why we see success for conditions such as rosacea or conditions such as telangiectasia, where the skin is very thin, where integrity is compromised and the skin is reactive. So by activating your own collagen response means a thickening of the skin. So all you simply need to do is just adjust your needles and maybe turn them up a little bit more. So if you're not getting the response that you used to get at 1 millimeter, then just simply turn your device up to 1.25. Or another way that I can treat is actually play around with anticoagulants, which means blood thinners. So I get the patient to either take some aspirin before treatment, a couple of tablespoons of fish oil or olive oil, 2 espressos, or a high energy caffeine drink, and all of these will actually help the patient bleed a lot easier at smaller needle depths. The final question is, what's a granuloma? A granuloma is where you have placement of a foreign body within the skin, and then the body undergoes a process to seal it off because it views that foreign body as an attack, and the body goes into defense mode. Simply, I want you to imagine when you were back in childhood and you got a splinter in your finger, but you didn't realize you had a splinter in your finger. And then you see this huge blister and you see this, you feel this immense pain and all this redness. That's the body viewing that splinter as attack. So when you force a molecule, think moisturizer, when you force something that is thick, heavy into the skin, and when it's viewed as being an attack or a foreign body, the body goes into a defense mode to try and seal that off, which creates small lumps within the skin. These can lead on to infection. These can also lead on to scar tissue. And this is what a granuloma is. Unfortunately, I didn't get any feedback of your bad experiences of what you see vloggers and bloggers advising people to do during isolation, but please put them into the Pro Beauty Pop so that I can have a look and have a read of the crazy things people are saying out there. Likewise, also, if there's any further questions, please put them onto the Pro Skin Pop, and then myself and the Pro Skin team can also have a look. That concludes today's session. A massive thank you to Michelle and Nikki, who are behind the scenes. A massive thank you to our moderators and tech experts, Hugo in Paris and Pete in Sydney, who are also behind the scenes. So you get to see me on your screen, but I see a whole host of engineers, of designers, of marketeers right behind this who have worked so hard to get these events live to your lounge. Thank you so much, and I look forward to catching up with you same bat time, same bat channel next week. Looking forward to then. Thanks so much, New Zealand. Bye.